Well, one of the key interventions that we're now recognizing in prevention is looking for a dressing which really conforms to the wound bed, because the key intervention is actually exudate management. And if we can prevent the pooling or pocketing of exudate, we can often prevent the formation of biofilms.
So if you have a dressing that is conformable and vertical wicking and sequestering, that is one of the main factors that you can do for prevention. The topical wound management is key.
So as I said previously, the diagnosis of a biofilm is really one of clinical judgment. And the key strategies in clinical judgment that we need to look at and ask ourselves, first of all, have we done everything in terms of diagnosis, appropriate intervention? Are we doing all the appropriate care for the wound? If we've done all of these things and still that we are seeing that the wound is not progressing in a timely fashion as we would expect it, we may suspect a biofilm.
And part of my whole service is finding out why these patients haven't healed in a time frame. And a lot of it goes back to not referring early enough and not doing the basic proactive wound management. So if we look at these questions and we say, no, it's not healing in the time frame we expected, and yes, we've done all of this, then it is probably biofilm in a healable wound.
Well, it's kind of a nice framework because it's a 5-step process. And for each step along the way, we tell you why you need to do this, when you need to do this, and how you need to accomplish it. So, for example, if we were to look at the mentioned before, managing the gap in this, why do we need to do this? Well, we need to do this because we know by preventing pooling of exudate that it's an important thing. And how do we need to do this? And when do we need to do this? We need to do this at every dressing change, and we need to choose a dressing that appropriately manages the dead space.
Each step provides the reader with the why, the when, and the how-to, and the steps are consistent of what you will find in the literature. It's just condensed for easy reading and easy understanding. And so wound cleansing, for me, it really is step one. And I've been going on about therapeutic wound cleansing for a long time. And, a lot of people have been anointing wounds for a long time. We understand now how important that is in preparing the wound for the debridement and preparing the wound for the wound dressing.
Well, it's short. And I think that's the key thing. It's concise. It's clear. It's a stepwise process. It's practical application for the working clinician in the day-to-day management of wounds. I mean, I love to give the example of some clinical practice guidelines. One I could quote is the Canadian Diabetes Association Clinical Practice Guideline. The last one was 274 pages. And I like to say, stuff that in your back pocket and carry it around with you so you know what you need to be doing. So we need a quick reference guide kind of approach.
It's ideal for the non-specialist providing wound care, so as a clinical resource, but also for those of us who are specialists, who are educating. We're looking for a synthesis, an easy way to teach. And I think the way that this white paper is set out, it provides a real structure, and the same way that we would lecture about how to do an assessment, what signs and symptoms to look for. So really, the message is clear that we are united against the impact and the burden of delayed healing. And so by having this document, this white paper, help us identify the problems early, to use our resources effectively, that we can provide the patient, the client, with proactive and targeted therapy.